I'm Dr. Rick Pecunia. I'm a plastic, reconstructive, and cosmetic surgeon here at Hattiesburg Clinic. I've been here for 24 years. Began my practice here right out of residency and have been here my entire career. For me, my path to plastic surgery was through a general surgery route. So I did a full general surgery residency and fully trained in general surgery. And then I did a plastics residency. All told, that was 8 years of training after medical school. So, of course, you do college and you go to medical school. And then the 8 years of training to come out to be a plastic surgeon. And that's when I started. And then, of course, you have to be certified, taking the exams and an oral board exam and things like this to be board certified. Hattiesburg Clinic was a little bit of a surprise to me, to be honest with you. I'm originally from New Orleans, Louisiana, trained in New Orleans and then did some training up north. Came back to Jackson, Mississippi to do my plastics residency. And honestly, Hattiesburg, Mississippi was never a place where I thought that I would end up practicing. Being in Jackson, but also from New Orleans, Hattiesburg is right in the middle. And as I was sort of migrating back to my home area to potentially practice, Hattiesburg caught my eye. And some friends of mine were here and they encouraged me to give Hattiesburg a second look and Hattiesburg Clinic a second look. And honestly, I started here thinking that I would try this for a couple of years and really don't think I could have done any better. So here I am still in the same original practice 23 years later. When I'm not at work, my greatest enjoyment involves things with my family, particularly my kids. I have a freshman at Ole Miss, I have a senior at PCS, and I have a freshman at PCS. And I think that if you talk to people who know me, you'll rarely see me out doing something by myself. I usually have one or two kids in tow, or my wife and I are going and doing something together. We're like any other family. We like to be outside. We love to boat and ski and fish and things like that. Several years ago, my boys got interested in golf, which I'd never had an interest in, but I took that up with them, and I like to do that as well. I'm not very good, but I enjoy going out there with them or with some friends. I'm actually a closet musician and played music for a bunch of years, both in high school and actually when I got here, when I first started practice, and I still do that as a hobby. I tell people that golf is my daytime activity and music is my nighttime activity. I feel like I'm very blessed to get to do what I do. I often tell people that I have the best job in the whole organization. My philosophy of care is to be sure the patients know that I'm their advocate. The field of plastic surgery is not just limited to cosmetic procedures or cosmetic surgery like a lot of people think. We are reconstructive surgeons. We do a lot of trauma work. We do a lot of problem wound care. We do a lot of reconstruction from cancer. We do a lot of children who are born with congenital deformities. So we have a tremendously broad base of patients that we work with. And each of them are in different places and different walks of life and different points of concern, if you will. And as a surgeon, I've got to take people to an operating room to do what I do. And that's scary in and of itself. So I want my patients to know that they've got an advocate that's going to walk with them and get them through all that scariness to get back to their degree of health they want to get to. Whether it's from an injury, whether it's from cancer, whether it's from aging, whether it's from a congenital deformity. I want them to know that I am going to be with them and walk them through the preoperative, the operative experience, and get them back to the point where I say, we're done. Have a great life.